Three reports and their claims have caused quite a stir in China. According to a US report, approximately 1 million people in China will die from corona by 2023. Following that, two epidemiologists from China made two claims. One predicted 3 waves of coronavirus this winter, while the other predicts that by 2023, half of China's population will be infected with coronavirus. Hello and welcome to India Today. I am Anjali Istwal. China is seeing a spike in COVID cases after the country lifted its stringent COVID-19 measures, sparking concerns across the globe. A top Chinese health official says he believes China is experiencing the first of the 3 expected waves of COVID infections this winter. Dr. Zunyu Wu is the chief epidemiologist of China's CDC, or Center for Disease Control and Prevention. He has warned that there will be 3 waves of coronavirus in China. According to Dr. Wu, this winter, the wrath of coronavirus will be at its peak and 3 waves will be there for about 3 months. Dr. Wu has said that the first wave will start from mid-December and will run till about mid-January. This is the occasion of Christmas, due to which the cases are expected to increase. The second wave will start in 2023 from late January to mid-February because at this time China will be celebrating its Lunar New Year and people will obviously travel. The third wave will start from the end of February to the middle of March, because then people will be returning back home from their travels, and this of course is a situation where risk of negligence can increase manyfold. The other shocking news came from Dr. Feigl-Ding, an epidemiologist and a health economist. He said that hospitals are completely overwhelmed in China. Feigl-Ding warned that the current wave of coronavirus in China may likely infect over 60% of the country's population in the next 90 days, with death toll likely to climb to millions. According to another tweet by Dr. Feigl-Ding, deaths in mainland China are being underreported outside China. A survey of hospitals, funeral parlors and funeral business chains in Beijing showed that the sharp increase in deaths has led to a sharp increase in funeral work. Dr. Feigl-Ding tweeted, and I quote, "Summary of CCP, that is the Chinese Communist Party, their current COVID goal is let whoever needs to be infected get infected, let whoever needs to die, die. Early infections, early deaths, early peak, early resumption of production. Dead bodies piled up in northeast China in one night." End of quote. At a time when the surge in COVID cases in China has completely overwhelmed hospitals, the health authorities are racing to install hospital beds and build fever clinics all across the country. There are clear signs that the virus is completely overwhelming the fragile health system of China. Many cities in China are putting their resources into expanding intensive care units and other treatment facilities. The Global Times has reported about this earlier. The health authorities are racing to construct fever clinics, facilities where medical staff check patients' symptoms and administer medicines. And if you look at the major pharmacies in China, the racks of cold and fever medicines are completely empty. In the past week, major cities including Beijing, Shanghai, Chengdu and Wenzhou announced they had added hundreds of fever clinics, according to government WeChat accounts and media reports. China's health authorities on Monday announced 2 COVID deaths, the country's first reported fatalities in weeks. With half of the population in China yet to be vaccinated, there is growing concern about possible deaths. Virus mutations and the impact again on the economy, everything is a cause of concern for the Chinese authorities. Beijing reported 5 COVID-related deaths on Tuesday, following 2 on Monday, which were the first fatalities reported in weeks, as we told you. The COVID situation in China continues to remain grim, with the explosion in funeral services and a sharp rise in deaths. China is persuading reluctant and senior citizens also to get vaccinated. Elderly people are more likely to suffer severe COVID symptoms. Meanwhile, health experts have remained completely tight-lipped about the threat posed by the virus in the recent weeks, which is a U-turn from previous messaging that the virus has to be eradicated to save lives even as the rest of the world has opened up. And we saw China taking a complete U-turn on its zero COVID policies, and the country started opening up this month. With the rapid rise in cases, schools in Shanghai and many other outbreak cities have been closed now for the next month. Do tell us what you think about this video in the comment section, and for more news updates, subscribe to India Today.